you very much for the invitation. I'm very pleased to be part of this celebration of Women's Month, and especially focusing on young women. And as the government of South Africa, we are indeed very committed to uplift the services for women to improve the quality of life. And specifically from the Department of Health, we are indeed very committed to ensure that there is universal access to sexual and reproductive healthcare services to all our women. And that includes family planning, information on sexual and reproductive rights. We want to make sure that these services are integrated together with other programs which empower women socially, educationally, economically. So it is our commitment to make sure that these services are provided as a right, not as a privilege, and that they are provided to the best way in which women, especially young women, can be able to access those services. As a government of South Africa and as through the Health Ministry and Department, we believe that we must be held accountable because what government is there for, it's to be accountable to the people, to provide the services in such a manner that they make a difference. And if we are not able to achieve that, we must be challenged. We want to encourage women, and especially the young women, because they are the future of our country, future mothers, future leaders of the nation, and not just as mothers, but also as leaders of the nation in all aspects of society. So we want them to hold their government accountable. If we are failing in providing some of the services, they must be able to be vocal and indicate the shortcomings so that we should be held accountable and make the necessary interventions and necessary improvements. It was very important, as you would remember, and also even not just launching the program, but also making sure that it's positioned at the very high level within government. The She Conquers program was launched by the then Deputy President, who is now the President of the Republic, in 2016. I think it was in the month of July, Peter Maritzburg. And it was pitched at that level because to show the level of commitment that the number two in the state must be the one who's actually launching that program. It was as a recognition of the fact that while there were all programs which I've mentioned already, providing services for reproductive health, education and all that, there was a recognition that whether we talk about HIV/AIDS, whether we talk about gender-based violence, the women and especially the young women of the country, who, as I've said earlier, are very key in providing a good future for the country, that they are the ones who are suffering the most. So there had to be a program which is very much focused in intervening in the areas where young women need to be supported by the state, making sure that they're kept in school, making sure that they are economically empowered, making sure that they are protected and they are empowered against gender-based violence, because if there's a very clear understanding that when you invest in a woman, you invest in the entire society. And especially when you invest in the young women, you can say that the future of your country and your society is actually ensured. So that was the reason why the She Conquers program was launched. Well, it is indeed very urgent. I mean, we all know that, unfortunately, as a result of our past of patriarchy, discrimination, Despite all the progress which we have made over the last 26 years, I mean, a lot of progress has been made, but it's urgent that women are empowered, because notwithstanding all that progress, there's still a lot of obstacles for women in terms of, making sure that there is absolute equality. Whether we talk about in the social settings, patriarchy is still there. Women are still not, given all the opportunities. Whether we talk about on the economic side, whether in the public sector, a lot of progress has been made. But if you look at the private sector, especially, and other public institutions, recently I was also just reading an article about leadership in your tertiary institutions. Very few women, have had an opportunity to be vice chancellors, principals, heads of departments at universities, and you go into many other institutions, you find the same kind of shortcomings. Not to even mention the very unacceptable high level of violence, gender-based violence, which are afflicting our women, especially our young women. So these interventions are indeed very, very urgent, and in fact, we're very late in terms of what we should have achieved for the 26 years of democracy. So we have to indeed double up our efforts in making sure that this services and empowerment of women, provision of health services, and all those should be made available at a very urgent basis. As a government as a whole, but also from the Department of Health, we are aware that the society is moving, and especially our young people, using a lot of modern technology. So we also don't want to be left behind. We want to make sure that in making available a lot of the information which I've mentioned, which gives empowerment to young people, especially young women, to be able, to make sure that they keep healthy, that they can protect themselves, that they can plan their lives, make sure that especially their sexual and reproductive life is properly planned. And so to provide that information, amongst others, we're trying our best to make sure that the services we provide are youth-friendly. So the youth zones are meant to make sure that at our health services, we can you can structure them in such a way that they are user-friendly for young people. So that's why we are encouraging our health facilities to provide very specific services which are properly tailor-made for young people in terms of time, away from all the older people who are coming there to collect their sugar, diabetes tablets, and blood pressure and all that. Make sure that the time and the kind of zones at which the services are provided are user-friendly, but also using technology. And that's why mobile services and also technology like BeWise, using live websites, is to make sure that young people can interact with these services. And I must also just add that if you look at BeWise as a form of portal for information, I can also assure the young people that they don't have to worry too much about data, because this service can be accessed on their mobile phones. They can access them on the BeWise website, and this is provided free of charge through our relationship with the various service providers such as Vodacom, MTN, and also Cell C. So this is good news, and we want to encourage our young people to access these services. Many people have correctly been pointing out that maybe it's a shortcoming in terms of many of our campaigns, especially in a country where we have so much gender-based violence that we need to refocus also, continue to empower young women and girls, adolescents, girls and young women, because indeed, as I've already touched on, they've been highly disadvantaged through patriarchy and, discrimination. But as we do that, many commentators have mentioned that we probably have neglected to also raise awareness and a proper, upbringing of our young men, because unless we also empower them to feel that, to show, there is no reason for them that to think that if you are to show power and success as a young man, you must prove that by, oppressing and subjecting girls to abuse and violence. That, you can stand up as a young man, you can be able to be recognized in society, be somebody who's making constructive contribution, and be properly recognized, and that macho strength is not necessary to show that indeed you can be counted. So so I think it is an important point. I think we need to find ways in which I know there are some other organizations, NGOs, which are focusing on the young boys, but I think maybe we're not doing enough, including also in the area of health services, including overall health for them, for themselves, their challenges which face young men, including their understanding of reproductive health and rights. Because if the girls understand their rights in terms of sexual reproductive rights and what they are entitled to in terms of control of their bodies, but the counterparts, because they are going to be in a relationship, and then you will find an imbalance, because the girls will be asserting their rights and the boys, on the other hand, feel threatened. So I agree that in a way we need to find a way in which equally there can be a lot more focus on empowering the young men so that they understand that coexistence and getting into young relationship does not have to depend on showing power and macho, power. So I agree with you that I think we need to put a bit more effort in empowering young men as well. I think if we look at providers, especially on the health services side, a lot has to be done in terms of making sure that our providers at the various levels, whether it's at the primary health, health promotion area, that they must understand that the young people are entitled and are mature enough to can demand particular services, and they must be treated as mature people when they ask questions, when they require particular services. They must be treated with dignity, while at the same time understanding that a young person is not just a small adult. They also have their own likes and there are things which need to be in which they need to be treated with particular kind of attention. So it's up to us to make sure that those at the front line of service provision are conscious enough about some of the fears of the young people, which may lead to them not being able to access the services. So more training, reorientation. I mean, it's known that some of our frontline service providers, when young people come for particular service, they say, "But where is your parent?" And those are the kind of approaches which does not help in terms of making sure that the services are user-friendly and that our young people are treated with the necessary dignity to be able to access those services.